Did you know that celiac disease affects about 1 in 100 people worldwide, but many cases go undiagnosed? This chronic autoimmune disorder is triggered by gluten, a protein found in barley, rye, and wheat. When a person having celiac disease consumes gluten, their immune system attacks the small intestine by mistake, damaging its lining and leading to a range of symptoms. From digestive issues to skin rashes and even neurological problems, the effects of celiac disease are wide-ranging and often subtle. In today's video, we'll dive deep into the common symptoms of celiac disease and explore how they can impact your overall health. Whether you're experiencing unexplained fatigue, mouth ulcers, or even weight loss, this video will help you understand the connection between these symptoms and celiac disease. Number 1. Digestive symptoms. Digestive issues are among the hallmark symptoms of celiac disease and often the first red flag for those affected. When someone having celiac disease consumes gluten, it starts an immune response that harms the lining of the small intestine, which results in a range of gastrointestinal problems. One of the most common issues is chronic diarrhea, which may be watery, foul-smelling, and often accompanied by bloating and excessive gas. Some individuals experience the opposite, and that is persistent constipation, as the damaged intestine struggles to regulate digestion properly. Abdominal pain or cramping is another frequent complaint, often described as a sharp or persistent ache. Unexplained weight loss may occur as the body fails to absorb essential nutrients from food due to the damaged villi in the small intestine. Additionally, people may notice fatty stools, medically known as steatorrhea, which appear pale, greasy, and difficult to flush due to poor fat absorption. With time, these digestive problems can lead to malnutrition, fatigue, and even secondary conditions like lactose intolerance, as the damaged intestine temporarily loses its ability to digest lactose. Number 2. Anemia. Anemia is a common and often overlooked symptom of celiac disease, arising from the body's inability to absorb essential nutrients due to damage in the small intestine. The most prevalent type linked to celiac disease is iron deficiency anemia, which occurs because the damaged intestinal lining fails to absorb enough iron from food. This can lead to symptoms like persistent tiredness, weakness, dull skin, shortness of breath, dizziness, and even headaches. In some cases, people may also develop anemia caused by deficiencies in other nutrients like vitamin B12 and folate, both critical for red blood cell production. Unlike typical iron deficiency anemia, another form known as megaloblastic anemia can cause additional symptoms like tingling in the hands and feet, a swollen or sore tongue, and difficulty concentrating. Over time, untreated anemia can lead to more severe complications, including rapid heart rate or irregular heartbeat, as the heart works harder to compensate for the reduced oxygen supply. What makes anemia in celiac disease particularly concerning is its subtle onset, often being the first detectable sign in individuals who otherwise show no digestive symptoms. If you're enjoying this content so far and want to stay up to date with more health tips and benefits, hit that subscribe button and join the Health Vitals family. Number 3. Bone or joint pain. Bone or joint pain is a lesser-known but significant symptom of celiac disease, often arising from the body's inability to absorb critical nutrients like calcium, vitamin D, and magnesium. This malabsorption can lead to osteomalacia or, over time, osteoporosis, which increases the risk of fractures and chronic bone pain. Joint pain is also often linked to inflammation triggered by the autoimmune response in celiac disease, causing swelling, stiffness, and discomfort in areas such as the knees, hips, or hands. This pain can sometimes mimic arthritis, making it challenging to determine the root cause without a proper diagnosis. Moreover, the body's inflammatory response may exacerbate existing joint issues or create a generalized feeling of achiness, leaving individuals feeling stiff and tired. If not treated, these issues can significantly impact mobility and quality of life. Number 4. Skin rash. A distinctive skin rash, known as dermatitis herpetiformis, is a well-recognized symptom of celiac disease and is often referred to as its skin manifestation. This intensely itchy and blistering rash typically appears on areas like the elbows, knees, buttocks, back, and scalp, although it can develop anywhere on the body. The rash is characterized by clusters of small, red, raised bumps that resemble blisters, or hives with a burning or stinging sensation. Dermatitis herpetiformis occurs when gluten consumption triggers the immune system to produce antibodies, which mistakenly attack the skin rather than the intestinal lining. While some individuals with this rash may not experience noticeable digestive symptoms, the presence of dermatitis herpetiformis is a clear indication of celiac disease. The condition can be diagnosed through a skin biopsy, which identifies the specific antibodies deposited in the skin. Number 5. Neurological issues. Neurological issues are a striking and often underdiagnosed symptom of celiac disease, arising from the body's inflammatory and autoimmune response to gluten exposure. These issues can manifest as peripheral neuropathy, characterized by tingling, numbness, or a burning sensation in the hands and feet. Another significant neurological complication is gluten ataxia, a rare condition that affects coordination, balance, and speech, making daily movements challenging and often leading to frequent falls. Individuals with celiac disease may also experience frequent headaches or migraines that can cause nausea or sensitivity to light and sound. Brain fog, marked by difficulty concentrating, memory lapses, and mental fatigue, is another common complaint, leaving individuals feeling mentally sluggish and less productive. In severe cases, untreated celiac disease can even cause anxiety and depression, as the gut-brain connection plays a pivotal role in emotional regulation. Number 6. Mouth ulcers. Mouth ulcers or canker sores are a lesser-known but common symptom of celiac disease. These small, painful sores can emerge on the inside of the cheeks, lips, tongue, or gums, making eating, drinking, and even speaking uncomfortable. The primary reason for these ulcers is the malabsorption of essential nutrients like iron, vitamin B12, and folate, which occurs when the small intestine is damaged by gluten consumption. Adding to this, the chronic inflammation associated with celiac disease can further irritate the delicate tissues in the mouth, increasing the likelihood of ulcers. For some individuals, recurrent mouth ulcers may be one of the critical signs of celiac disease, particularly if they do not experience prominent digestive symptoms. Diagnosing celiac disease in such cases can be challenging but crucial, as untreated celiac disease may lead to worsening nutrient deficiencies and other complications. Number 7. Reproductive issues. Reproductive issues are one of the most important yet overlooked symptoms of celiac disease, affecting both men and women. In women, celiac disease can result in irregular menstrual cycles, amenorrhea, early menopause, or unexplained infertility. These are often linked to hormonal imbalances and nutrient deficiencies, particularly of iron, folate, and vitamin B12, which are vital for a healthy pregnancy. Pregnant women with untreated celiac disease face a higher risk of miscarriage, preterm birth, and low birth weight, highlighting the critical importance of proper diagnosis and dietary management. Men are not immune to these issues either. Celiac disease can result in reduced testosterone levels, decreased sperm quality, and even infertility. Additionally, both men and women may experience decreased libido or sexual dysfunction as a result of chronic fatigue, malnutrition, and the emotional toll of living with undiagnosed celiac disease. Number 8. Weight loss. Unexplained weight loss is a common symptom of celiac disease due to the body's inability to absorb nutrients. When someone with celiac disease consumes gluten, their immune system attacks the intestinal lining, damaging the villi, which are responsible for nutrient absorption. As a result, essential calories, proteins, fats, and vitamins pass through the digestive system without being properly absorbed, leading to unintentional weight loss. This symptom is often accompanied by other signs of malabsorption, such as diarrhea, fatty stools, and persistent fatigue, which further deplete the body's energy reserves. In extreme cases, the weight loss can be dramatic, leading to visible muscle wasting and a weakened immune system. While weight loss may initially seem beneficial to some individuals, it is a clear sign of underlying nutritional deficiencies and intestinal damage that requires immediate attention. Thank you for watching. Now that you know more about the symptoms of celiac disease and how it can affect your health, it's important to stay informed and take action if you're experiencing any of these signs. Remember, a simple blood test and a strict gluten-free diet can make a world of difference when it comes to managing celiac disease. If you found this video helpful, make sure to hit that like button and share it with anyone who might benefit from this information. And don't forget to subscribe to Health Vitals for more videos on healthcare and natural remedies. Take care, and I'll see you in the next video.